Today I'm going to talk about the rapid antidepressant activity of herb medicine, the underlying novel mechanism and synergistic action of the compound. So this talk is going to break up for 4 parts. First, we want to talk the motivation for this research, the rapid antidepressant effects by herb medicine called Yueju. Then we want to show you the preliminary evidence from the clinic about this activity, and followed by why this medicine works. And then we figure out what the primary compound that is acting. So we all know that depression is a major global public health challenge. In the worldwide, about 300 million people now suffer from this disorder. In China, it is estimated about 100 million. Actually, it's more severe since COVID-19. And one of the devastating effects of this disease is the suicide. But the good thing for this disease is that we do have drugs to treat them. Right? We have many drugs. And the mainstream drug is SSRIs. But we also have to keep in mind that there are also some obvious disadvantages. For example, it may benefit only for a part of patients, and also cautions on juveniles or pregnant women. And also there are some side effects, like sexual digestive dysfunction, and they may have withdrawal syndrome, which has been reported in the first day conference. So it needs long time treatments before show the effect, so that it has a delayed onset time. And recently, it has been found since about 10 years ago. It has found that ketamine can show rapid antidepressant. It can start the effect as soon as 2 hours, and then can last, the effect can last for up to 2 weeks. And it has been a big breakthrough since 2010, and still every year there are publications in the top journals in Nature or Science. So, on the other hand, we do have Chinese herb medicine, which are widely used for depression treatment in China. So for Chinese medicine, it's very different from the Western medicine. But basically, in this system, the doctors first identify the specific patterns of syndromes, and then form a formula to deal with the symptoms. So there are multiple, that means there are multiple herbs, especially with formula to treat the disease, including depression. We have focused on one herb medicine called Yueju pill, as this drug shows some feature of rapid antidepressant effects. As earlier as, we reported the result about 10 years ago. We showed that in this drug consists of 5 herbs. And this is the quality control to show the stability of the preparation. And we show that this drug can rapidly reverse the depressive symptom, especially in the model called novelty suppressed feeding test, because if we use If we use this test by using the fluoxetine, you have to take several weeks treatment before it shows the effect. However, we show that by using ketamine, only one dose, it worked. And for yueju, the herb, also can show effect within one dose. And we show that it works. At the very beginning, we show the mechanism is called the rapid protein synthesis of hippocampal BDNF. It's required for the rapid antidepressant effect. And we show that actually within 30 minutes, this yueju can increase the BDNF expression like ketamine. And also we verify the effect in the depression model called chronic unpredictable mild stress model for 3 weeks, and we give a single dose of yueju and test of subtle behavior, including one called sucrose preference test, which mimic the test of anhedonia. And we show that within one dose of yueju in this model, the animal can have the effect to recover the SPT behavior within 2 hours, which can last for 6 days. And we also test the underlying, the more complicated signalings, which is related to neuroplasticity. So then we want to know whether it really works in human. And we have done a preliminary pilot study. In this study, we have 2 groups. One group of patients take fluoxetine for 10 days with placebo of Chinese herb medicine. And the other group takes fluoxetine together with yueju, and we show that as early as 3 days post-administration, there's a significant improvement of this in this experimental group, while there's no change for the fluoxetine group, which we know that it have late onset. And actually, by 7 days, and we discontinue the herb medicine and test the score of the depression again, we still can see there is a persistent improvement in the yueju group compared to no change in the fluoxetine group. And more recently, we showed actually we can take advantage of the early antidepressant response at the early time to predict the long-term effect of this drug. And it showed that we can use as a word called neuroplasticity index, which is the ratio of serum BDNF over the Hamilton 24 scores. We can show that we use this index can predict the effect as early as 4 days post-administration of the drugs to predict the long-term, the eventual outcome of the drug treatment. And similarly, we use fMRI technique to show that we can also use this as MRI structure data to predict the effect, the long-term effect. Especially, there are some specific measurements. Due to time restriction, I will not explain the detail. And especially, we show that the visual network activation have a good prediction value for this drug. Okay, so then we all want to know how this herb medicine works. So we know that traditional, conventional drug, the hypothesis is that you kind of deficient of all these neurotransmission like serotonin or norepinephrine, but since there's a lot of problem with this drug treatment, so now more and more of the people accept the hypothesis called the neuroplasticity hypothesis. We suggest that the loss of the neuroplasticity in the specific neural circuit from hippocampus or prefrontal cortex is responsible for the depression. And if we can rapidly improve the neuroplasticity, we can show the rapid antidepressant effect. So then we want to ask what the specific mechanism for Yueju, and we use the transcriptome method to unbiasedly to check what is changed by this drug, and we found the one chemical called PACAP, which catch our attention. As this chemical is a neural peptide. It's expressed in both brain and the gut. So it has been reported that the variation of this drug and the receptor is typically associated with anxiety and PTSD. However, the relationship between PACAP and depression behavior is conflicting, but this relationship in the hippocampus has not been reported previously. So we confirm that this Yueju can quickly activate this drug, this chemical expression in both gene and protein expression level. And then we validate this target, including pharmacological activating by put the agonist into hippocampus. We can show that after this, it quickly induce the antidepressant effect, and this effect can last for 7 days. It's very similar to the effect of Yueju. And also, we can use the more current technique called optogenetic method, in which we specifically activate the neurons in the hippocampus that express PACAP. And then we found that if we activate this neuron, the animal can quickly show the antidepressant response. And if we activate longer, for 30 minutes, and this antidepressant effect can last longer. And on the other hand, we can show that we use the PACAP antagonist, and we found if we use this guy, the antidepressant effect of Yueju is blunted. And similarly, if we inhibit the PACAP neurons, the effect of Yueju is also blunted. Well, furthermore, if we knock down, so we reduce the expression of the PACAP. Similarly, the effect of Yueju is also blunted. So we found that in the different depression model, we also found that the expression of PACAP in the hippocampus are reduced. So that this kind of a pathological verification of this target in the brain. So our study show that this, if we activate PACAP, it can actually recruit both the protein, the gene expression and the protein expression machinery, which is responsible for the rapid and the long-lasting antidepressant effect. On the other hand, if we reduce the expression of PACAP, for example, by the chronic stress, and then it can show the depression behavior. So with this in hand, we can further ask whether we can use these targets to validate the effective compound of yuezhu. Okay, then first we need to know, because yuezhu consists of 5 drugs, we want to know which drug is the most important. And we use this method. We show sequentially test the effect of the different combination. We found that the one drug called Gardenia jasminose plays the primary role for yuezhu. And we verified this effect both behaviorally and molecularly. And also we use the kind of separation of different compounds in this drug, in the herb medicine called Gardenia jasminose. And we found that 2 standardized fractions both can induce the rapid antidepressant. And even another population of the ingredients it's called gardenia yellow pigments can also induce the antidepressant effect. So these data all show that in this herb, there are several components, which a mixture of different compounds, are effective to induce the antidepressant effects. But the problem is, to induce the antidepressant effects of this compound, it may need a relatively high dose, which is much higher in the formula. So then, we then test individual compounds, called 2 compounds here, GP and SM. And we test the contents of these 2 compounds, which are enriched in yuezhu. And we found if we use the dosage proportional to yuezhu, which means it's very low dose, by themselves, it didn't work because the dosage is very low. However, if we combine these 2 compounds together, it can activate PACAP expression and also can induce the rapid antidepressant effect, which means there is a very remarked synergism of 2 compounds in yuezhu at both the molecular level and the behavior level. And also, again, we use the different approach to validate this effect, including the optogenetic method. For example, if we optogenetic inhibition of PACAP, the effect of this combination of the 2 compounds is eliminated. To summarize, we show that yuezhu, similar to ketamine, 1 single dose of yuezhu can induce a rapid and persistent antidepressant effect in both chronic stress animals and in MDD patients. And our study showed that the neuropeptide, PACAP, is a key molecular substrate in the hippocampus that mediates the rapid antidepressant effect of yuezhu. We previously we identified that one of the 5 herbs in Yueju called Gardenia jasminol plays a primary role of Yueju in the rapid antidepressant response and the underlying mechanism. And with PCAB as a standard, we identified the enriched compound of GP and SM with proportional dosing in Yueju can synergistically activate PCAB and elicit antidepressant effect. So before I finish my talk, I would like to also introduce, lately we kind of developed some Chinese herb medicine which to prevent or treatment of depression only use these so-called herbal food formula. So we know that, compared to the diagnosed MDD patient, a large proportion of this high-risk MDD patient population. So it is better to prevent it before to treatment, because right now that's not very good, the treatment effect is not so good, right? So based on our knowledge of this research, and also the knowledge of this from classic traditional Chinese medicine, we formulated so-called the psychotropic food formula. This is the food formula consisting of multiple herb foods, and with each of them has a psychotropic effect. And also together, they have very, very strong effect, which can activate PCAB and reduce the stress response. So this is, has the antidepressant effect, but on the other hand, it's very safe, right? The safety profile is at the food level. So it can use to treatment or especially for the prevention of the depression in those high-risk MDD population. Finally, I would like to thank my lab members, my previous and the current lab members, the funding agency, and also my collaborators, and thank you for your attention.